So thank you, Cecilia, for being with us. So Cecilia is for Global Climate and Alliance and Columbia University, and she will talk about training the health workforce for degrees and beyond. So Cecilia, I'll give the floor to you to introduce yourself and to go into your speech. Thank you very much for being with us.
Thank you so much. It's a pleasure to be here today. My name is Cecilia Sorensen. I'm the director of the Global Consortium on Climate and Planetary Health Education based at Columbia University. And my goal today is to share with you a perspective on the essential role that health professionals play in responding to the climate and health crisis and how we can develop education to enable and inform action. So as we all know, climate change is rapid, it's intensifying, and it's really a defining emergency of our generation. And what we know from the IPCC is that the severity of climate-related health impacts is highly dependent on how well health systems can prepare people. So said another way, these widespread impacts from climate change are not inevitable because we as health professionals have a huge capacity to buffer impacts. And really the potential for us to create change is enormous. Globally, health professionals are a workforce of over 50 million, all play a role in reducing the impacts of climate change on our patients and in our communities. And we know that from a large recent multinational survey of health professionals that many of us already feel that climate change and planetary changes are affecting our communities and are affecting our patients across a broad range of categories. And many of us feel this responsibility to act, yet despite these high levels of engagement, there are many challenges that we are facing around getting education into our training programs. So the way I sort of think about this is, there's many different places where we need to be rapidly disseminating education. We're thinking about, undergraduate medical and clinical education, graduate medical and clinical education. And we also need to be thinking about the practicing professionals who are already out there. They need education as well. So because of this, the Consortium on Climate and Planetary Health Education was formed in 2017, and we have a mission to ensure that 100% of health professionals have the knowledge and skills to recognize, respond to, and prevent climate and planetary health related health impacts in the communities where we serve. And so what we do is we organize, we empower, and we amplify the voice of health professionals to promote solutions. What our work consists of at the consortium is that we obtain commitments from health professional deans and heads of school to educate their patients in climate and health. We bring together member institutions to create and share best scientific practices. We develop global standards and resources, and we work to build a pipeline of health professionals who focus their work on climate and health. So right now we have, this is a little bit outdated, but we have over 300 schools participating in about 56 different countries. And additionally, we work with many NGO and government partners to really do our program implementation and design. So one of our sort of functions is that we develop and iterate a list of core competencies for health professionals, because this really can guide curriculum development if we're all sort of having a shared view of what the role is of health professionals and how we're going to equip them to be able to handle this crisis. And so these resources are all available on our website, but roughly they cover climate and health knowledge and analytic skills, climate change and public health practice, climate change and clinical practice, policy aspects of climate and health, as well as climate and health communication. So different context right now, we did a big initiative with the Association of Schools and Programs for Public Health, whereby we integrated the GCCHE core competencies into competencies for public health professionals. And we're able to create this amazing crosswalk where we're able to sort of show how the professional competencies required for public health professionals really can fit seamlessly into the roles that we need public health professionals to be taking on as it relates to the climate and health crisis. Our competencies are also being utilized by the Association of Schools and Programs for Public Health in the European region, and you can find these resources on their website as well. In terms of addressing sort of this aspect of how do you train existing health professionals, we are working really hard to make training programs free, accredited and certificate-based. And so just this past spring, we launched 3 courses, primarily in the Americas, although we had participation globally on these. Our first initiative was in North America, where we worked with Health Canada as well as the National Research in the US. We then ran a course in the Caribbean with the Caribbean Institute of Meteorology and Hydrology, as well as Earth Medic and Earth Nurse. And we ran a course in Latin America, which was all in Spanish, that was in collaboration with the Pan American Health Organization and the Inter-American Institute for Global Change Research. And so just this past spring, we trained 5,000 health professionals, and these were folks coming from the backgrounds of health, environment, and we engaged deeply among ministries of health in these regions. So I think in summary, we need broad-based education that is free, that is accessible, that is evidence-based, and that is really being given by folks who are coming from the region. And it gives an opportunity to really build a community of practice around this new information and knowledge that we're trying to get out there so quickly. We also run short kind of boot camps for climate and health. These are run through our Columbia SHARP program, but they're open to all. There is a charge for these, but it's really kind of this intensive 2 to 3 day workshop where we bring together health professionals and we have really robust and vibrant conversations about climate and health. They come out of it with their certificate and really a cohort that they can go on to work with in this space. Another area we're working with is among how do we build resilience in frontline field epidemiology communities. These are often the folks who are looking at outbreaks of animal and human diseases, and they currently do not have climate or planetary health or One Health integrated into their curriculum. And so we are working rapidly to really sensitize these communities and provide strategic support in terms of updating their curriculum, updating their case studies to make sure that we are able to hit these targets. Everyone is welcome to attend our workshops, which happen the 4th Wednesday of every month. Another opportunity is that we are working with Healthcare Without Harm to run a quarterly Grand Rounds standing lecture series where we bring together sort of the best practices around rapid decarbonization of the healthcare sector. Coming up in December, we have a whole session on food-based solutions and how we can improve diets and simultaneously combat non-communicable diseases through the use of plant-based diets in healthcare settings. As part of our work with the consortium, we also have a robust learning collaborative where we are bringing together educators, bringing together faculty to try to get some more sharing of ideas and really innovation being built in this space. This incredibly vibrant time happening right now, whereby many schools of medicine, of nursing, of public health, of pharmacy, of social work are really rapidly developing new curriculum to train health professionals, and we want to be able to capture this. And so we have 2 open calls for papers right now. The first one is in the MedEd portal, and the second is Frontiers in Public Health. Both are open and accepting submissions right now for those of you working on curriculum and working in the space of capacity building and education. And also is the Planetary Health Report Card, which was developed by an international group of students, which is really a student-led initiative to assess how well their health professional training institution is doing to prepare them to really be planetary health leaders. A large initiative I also want to put on your radar is the Climate Resources for Health Education. This is an initiative that has been the result of the coming together of dozens and dozens of health professional schools, whereby we're creating evidence-based and peer-reviewed educational resources such as slide decks and problem-based learning cases. Everything is free and open access. We are actively and always looking for team members to serve on teams to create slides, to create problem-based learning activities. And so we welcome you to check this out, to use the resources, as well as if you're interested to contribute to these initiatives. So this is just a snapshot of some of the work that we're doing. There's a lot more, but we welcome all of you as members of the Global Consortium on Planetary Health Education. You can find us on the web. And in closing, I just want to share a video that was put together by our student committee. So let me just roll that up quickly.
Cecilia, if you can share the sound also into the When you are sharing the screen, you can select share sound.
Student.
As a medical student,
Dear health education leaders,
as a public health student,
as a pharmacy student,
As a dietetic student.
as a medical student,
as a nursing student,
as an epidemiologist in training,
I feel ill-equipped to prevent the health harms of climate change my patients and communities face.
In the recent months, climate change has fueled one of the most violent tropical storms ever faced by areas of my country that are usually spared.
Here in Richmond, Virginia, heat waves affect communities of color and low-income neighborhoods disproportionately, and yet I'm not taught what that means for their health.
The evidence is clear for more frequent and severe wildfires, to floods and droughts, poor air quality, and increased spread of infectious diseases. Climate change is the greatest threat to health that we face in the 21st century.
The COVID-19 pandemic has already highlighted the unprecedented strain that large-scale health crises place on health systems and healthcare workers.
And low-income communities of color, indigenous communities, will suffer the worst consequences.
A whole generation of nurses and nurse practitioners.
A whole generation of doctors.
A whole generation of pharmacists will have to care for those who suffer from the health harms of climate change.
Yet there's little formal acknowledgement of the coming climate catastrophe in our education.
But the solutions we need already exist.
The Global Consortium on Climate and Health Education has resources and frameworks for educating all health professionals.
Our health education encourages us to think deeply and collaboratively about the health problems we face.
And climate change is no different.
educating us on the impacts of climate on organ systems, structural determinants of health, health policy, and health system science is an opportunity
to prepare us to face the challenges of a lifetime.
But we need your help to make it a reality.
We need your leadership to push for sweeping educational reform,
required to prepare a generation of healthcare providers to address the consequences of climate change.
If schools integrate the impacts of climate change on health into existing curricula,
then as an epidemiologist, I will be able to better understand the interaction of climate change with health risks and health outcomes.
As a physician, I will be able to talk with my patients about the impact climate change is having on them.
As a nurse, I will be able to provide heat action plan for my patients in a heat wave.
We, as health professional students, will spend the entirety of our careers working with patients and in communities increasingly impacted by climate change and environmental degradation.
With the proper training,
we can fulfill our duties as health professionals,
secure the health of our patients,
and achieve a more just society.
For your interest in this and for your attention. We look forward to working with you. If you are interested, I will hopefully link to the GCCHE website, and I hope you all have a great day. Take care.
Thank you very much, Cecilia.